You're welcome back to Sunday Breakfast right here on ChannelOne TV. We're going into our health conversation. We have Dr. Nkalsum Zakaria Adam, a public health practitioner and specialist maxillofacial surgeon, joining us. We're talking constipation. I know this topic would interest a lot of you because we all get constipation once in a while. If you have any questions, do send them to the WhatsApp number 0204 447-033, 0204-447-033. Doc, you're welcome.
Thank you, Enu.
I know Jude wants to ask you something.
How is Kolobu doing? I actually didn't have any question for you, but how is Kolobu?
Very well, we are doing
well. Our doctor
how are doctors doing?
We are all doing well.
And the nurses?
We are all fine.
And your ambulance drivers there?
They're also doing fine.
Everybody
is fine.
Everybody's fine.
So we thank God.
We thank God. We thank God.
Is it ready? If there's an emergency now, are you ready, Kolobu?
We've always been ready. But the only challenges may be that sometimes there isn't enough bed space to be able to accommodate, but there are protocols that are laid down to go through that, so that any patient who is sent away or any patient who comes in a critical condition at least has some medical care before being redirected.
So that's what you call the triage?
Triaging, yes, it starts with that as well, triaging, where, I mean, you're able to tell who is red, who is yellow, who is whatever, based on the color codes that we do have. And that would help you know which of these patients need maximum attention or need urgent attention compared to others. And you need to at least make sure that these patients are not in very they are not in states that would lead to their death, but then they are stable for them to be able to transport it to whatever, whichever
just
facility.
very briefly on this. Dr. Thomas Anaba, you know, is a former CEO for Orange Hospital. He yesterday said that it is agreed with the way all three hospitals, including Kolobu, handled the case involving, you know, the late Charles Emisa, with regards to your response to the ambulance service when they arrived. Do you agree with him?
Well, I haven't heard what he said specifically. What
he said it was unacceptable.
Exactly. I mean, it is not acceptable to have that done. What it is that, you know, there's a system. The system is that before you even send a patient to a facility, there are channels where you would have to call to be sure that they are ready to receive such a critically ill patient. But certain times, these rules and regulations are breached. So people just walk in, or people just drive into a hospital and they demand that they want to be seen. You get it? So that is where the challenges may be, where sometimes the healthcare professionals who are triaging need to, even if that happens, they need to still be able to have a look at the patient, make sure that the patient is stable and is not in a state that they may end up losing their lives whilst in transit. You get it? Before they send away to other facilities where they can be accommodated. So that has always been the system that needs to be followed. Anytime there is any referral that needs to come to a tertiary institution, these are some of the channels that need to be followed. But sometimes, I mean,
so the ambulance service, as things stand now, don't have a system of verifying which beds are available in what hospital?
No.
So even after the recommendations in the last report?
So it depends. Possibly steps are being put in place to get that done. But what happens is that most of the time, the hospitals are called directly. So you call the hospital will tell you that, okay, according to our bed space currently, we have these so and so number of beds, so you can let the patients come in before you move and then come. And then certain times people don't even call, they just come in. And if you do come in and you come to a facility where all the bed spaces have been occupied, it becomes very difficult to be able to accommodate such cases.
But even in that protocols, yes, in such a situation.
Exactly, yes. Yeah. But even in that state, as I said, you don't have to send or turn away a patient who may end up losing their lives through transit. So you need to stabilize at least. If you need to give a line, you do give a line, start running some infusions, whatever that you need to do to stay. If the patient is bleeding, do something about it. And then safely send the patient to where they can have their care.
What are the challenges you are facing in Kolebu that would need to be resolved so that we don't keep coming back to this
Well, one of them is, this whole system where sometimes patients just come in. That's one. Not respecting the protocols that are there already. Calling to ensure that you would have the space. Calling to ensure that, yes, when you do come, the hospital staff would be able to take care of whichever case that you are bringing in. That's one. The other has to do with even the ambulances. How responsive these ambulances are.
The response rate.
Yes,
in Accra, the ambulance service says that it's 15 minutes, even though a lot of people doubt it.
Exactly.
So it should be shorter.
Shorter than that. You should always have drivers on standby.
This is a country where even when we hear the siren, we don't even give them space.
Don't even move.
That's a
we
problem.
don't move. So those are some of the challenges. And it's good that this. It's not good that it has happened.
Yeah.
But then it is going to, yes.
Look, I'll end on this briefly, right? But you're a public health advocate. You do a lot of that.
Yes.
Another public health advocate, in fact, has a PhD in public health, Dr. Ishmael Norman, yesterday on Big Issue also said that a challenge is also with the kind of health care professionals that we have. He said that some young doctors or new doctors, in quote, are not even well placed to interpret an X-ray, and that is part of the challenge. I don't know what your response would be on that.
Well, I would not agree with that because once you become a house officer, so it's a whole process. You start with school. When you finish, you do become a house officer. When you do become a house officer, you are under training. You're still under training. You do have senior residents, you do have residents ahead of you. So there's always somebody ahead of you to give you the needed help that you need if you have challenges. So that I would not agree with because there's almost all the time somebody ahead of you.
Young Ghanaian doctors are qualified.
Yes.
Okobo says you are qualified and capable to practice anywhere in the world.
Exactly. So it's a whole system. Once you go through house job, after house job, you become a medical officer. Once you become a medical officer, because of the type of training you go through during your house job and you are signed off, I would also agree with the fact that you should be able to, man wherever or whichever hospital where you are posted.
So it's not true young doctors can't interpret X-ray.
It's not true because you will go through the whole process
before you're qualified.
Finally, I want you to watch into the camera and speak to people who feel like healthcare professionals are insensitive, right? They don't give their best and sometimes are indifferent. NO uses the word numb because of all that you see, right? What will be your response to them?
Well, I would say that it's not true. Healthcare professionals are human. Healthcare professionals feel as well. Healthcare professionals almost all the time want to give off their best. They always would want to make sure that they see their patients smiling. And I don't think that healthcare professionals are numb to some extent. When you do see a lot of these deaths over a period, it doesn't make you numb, but it also makes you see the fragility of life. And healthcare professionals are your friends, and they are here and they are ready to give up their best so that every patient who comes in with a problem would feel very safe and very, very comfortable to share their problems because they'll leave the hospital smiling and better than they came. Thank you.
Thank you very much. I didn't intend to
As
go
I
that route.
was saying, Doc for GMA president.
Oh, yeah. Are you interested? I'll support your campaign.
We'll support your campaign from here. Don't worry. We're talking constipation, and now I know that you eat a lot of bread, plenty bread, and you go and sit on the toilet, nothing comes, and then you're forcing yourself.
Yeah.
Is that what constipation is?
Yes, so it's part of it.
Okay.
Okay, so constipation, basically we have acute and then we have chronic constipation, depending on the duration at which you started having some of these signs and symptoms. And so constipation basically is when you do have, so I'll mention a few signs and symptoms. And if you do have any of these signs and symptoms, about 2 or more of them is considered as constipation. So if you do have hard stools, okay, and these hard stools, anytime you go to the loo, you tend to strain, so straining during that period of defecation, and then inadequate or you not being able to evacuate all the feces at a point in time is another sign. And then the last one being that if you do have any of these happening within a week, let's say when you take a week and you notice that you have any of these signs and symptoms that I have mentioned, you are unable to defecate more than or less than 3 times within the week. If you have any of these that I have mentioned, 2 of them or more, then it's considered as constipation. So hardened stool, straining, inadequate evacuation of your rectum, and then having any of these signs and symptoms, and you are not able to actually defecate for greater than 3 times within a week, that is considered as
3 times within a week?
Yes, 3 times, yes. Some people are not actually able to some people
some people for a whole week they haven't gone.
Exactly, so less than 3 times
that's
a week
being constipated.
That's
wow,
being constipation.
Well,
so those are
it's so some people I know, it's like my mom and some of my aunties, like when they go to a new environment, they can't use the loo.
Yes, there are people like that.
Yes, unless they come back to their house and use the loo. So for however long that they're there, that's considered constipation.
No, so aside, so if yes, let's say sometimes it does for such people, because they're in a new environment and they try to psych themselves in such a way that, okay, I don't want to use the loo. That's one. So they refuse the urge to defecate.
Okay.
So if you refuse the urge to defecate, that means that whatever waste that's in your large intestine or in your colon will stay longer there. And if it stays longer there, then water, that is where water is reabsorbed from the whole system. So water will be reabsorbed, and means that whatever that is left within the colon or your rectum would be very hardened, and then that can lead to the constipation that they may be facing. It's also likely that such people would want to stay away from certain foods that tend to help them to it, or that tend to give them that laxative effect. So they will be very careful when it comes to even their water intake. They'll be careful when it comes to the kinds of fruits and vegetables that they do take to help them, just because they've psyched themselves that I'm in a different environment and I do not want to use the loo in such an, because I'm not comfortable. So in that sense, they have certain ordered steps that will lead to the constipation that they may face at that point in time in their lives.
I remember doing a report and going to some parts of the capital, speaking to young people, and they didn't have a toilet facility in their house. So I remember asking one worker there, how do, it's like, oh yeah, but there's a public, but he's not even comfortable using the public, so you go to the office and I was wondering, how are you able to, because there are times you have emergencies.
Yes.
So is it proper and that people keep it so they are able to?
Well, it's not proper, but then as I said, if you refuse the urge to visit the loo, the body will respect it, unless it's an emergency. Exactly, unless it's an emergency, and that's even the diarrhea. Diarrhea. That does not qualify to be in that. Exactly. Okay. You get it. But if you do refuse the urge,
how does your body know that you are refusing the urge? Like, Is it the mind?
Psychologically, yes. You just tune off that you are not
You're not
going to use the loo. Yes.
I'm
If you're not
assuming
going to use it,
your diet and your
Yes.
lifestyle will play a part
very,
in,
very important
So what
role in
foods
it.
are we eating that are making us constipated?
Constipate,
Yeah.
So most of the foods like the white breads, taking these refined foods, the foods that do not contain roughages. So very little fruits and vegetables within the food that you are eating. All of these foods can lead to constipation. So one of the things that roughages and then fruits and vegetables do to help with bowel movement is that it increases the bulk. It increases the bulk of the waste product that is going down there. So that's one. So it increases the bulk. Once you have bulk, it means that when it gets there, even when you are taking in water, that water to soak some water and help to make the stool softer so that the stool can come out when it has to come out. But if you do have these refined foods, most of them are digested, they become very little and you don't have that bulk. And when it gets to the large intestines too, what happens is that is where you have water being reabsorbed into the whole system. So then whatever that is left within the colon, whatever that is left within the rectum is very, very small, scanty, and then is dehydrated. And that can also lead to the fact that you end up with some constipation. So difficulty in defecation, difficulty because of the hardened stools, and then also yes, so basically those
things
happening. Yes.
Does drinking a lot of water help?
Yes, so drinking a lot of water does help. So it's been shown that at least if you do take some water, at least 2 liters, 3 liters per day, that helps to give you loose stools, or that helps to help you avoid getting into constipation as well. So it's very important that you incorporate some fruits and vegetables in your diet. And the causes of constipation, there are a number of them. So some of them that I would want to mention is that sometimes even certain medications that you are taking can lead to constipation. So certain medications like some opioids or narcotic medications that you are taking for pain can lead to constipation. Some antidepressants medications, some anticholinergics, some even sometimes antihistamines can lead to constipation. Certain times too, aside these medications that do cause constipation, the fruits, the lifestyle modification that we have mentioned, not incorporating them into your regular diet, can also lead to constipation. And there are other underlying conditions that can predispose you to constipation. So other sinister or other more complicated cases. For instance, it's likely that if you are unable to pass stools and you're having constipation, it's likely that there's some mass within your colon or within the rectum. So patients who have risk factor of developing colonic cancers can actually have a sign and a symptom of constipation as one of the first things that you may end up having. So if you do have certain masses, if you do have certain hernias within, or you do have something we call volvulus, all of these are structural problems or anomalies related to the large intestine that can predispose you to getting constipation. And that's for these conditions, you should have very high index of suspicion. And maybe that would be the first sign that you may actually discover, to be able to know that you have other things happening within the system. It could also be that in people who are diabetic, because of the neuropathies that they do have, it tends to reduce the peristaltic effect of the GIT. So then you end up with some constipation as well. Sometimes electrolyte imbalances. So these, when you do have something we call low potassium levels, or when you do have high calcium levels within the system, that can also affect the muscle tone and then lead to reduced peristalsis, and then you end up with constipation as
There's
well.
a question here
And
for
then,
you, Doc. Finish.
Okay, and then certain like hypothyroidism, when you have low thyroid hormone levels, or you have hyperparathyroidism, all of these are some of the endocrine causes of constipation. Yes.
So the question is asking if constipation can cause hemorrhoids.
Yes. So, because remember my definition from beginning, I mentioned that you have hard stools. So then when you go and visit the loo, what happens? Straining. So if you are straining, it means that you are going to cause what? Increased intra-abdominal pressures. So it doesn't even only cause hemorrhoids, but because of increased intra-abdominal pressures. But then also sometimes you may end up with certain hernia. Hernia is also happening due to the constipation because you are going to strain. So if you do strain, then that will lead to, so if you have any weakness in any of the abdominal walls or any part, then you can have protrusion of those internal organs out of where they are supposed to be. And that can
Does coffee help, or is it a myth?
Yes, coffee does help actually. So coffee helps with actually increasing the muscle tone so that you can end up what's the name? Having some loose too, so it does help. So it's like a laxative of some sort. Right. So that can actually bring us to some of the medical management that you can have when it comes to constipation. So when it comes to constipation, the aside your lifestyle modification, taking in a lot of water or taking enough water, taking fruits and vegetables, the medical aspect of it would be that you can have some laxative that you can take. So like some osmotic laxative. An instance is lactulose, where you be taking that, and that would help you so that it would draw water instead of absorbing water. It would draw water more towards the stool so that it can come out. Others could also be that you can have some stimulant laxatives, where an example is like Bisacodil or Dulcolax. So that would help with the peristaltic movement of the GIT, so that you can actually end up having or expelling the waste product, and then it also helps to reduce constipation. And then the other treatment modalities aside, the lifestyle modification and then the medical management would have to do with what the underlying problem. So I mentioned if it is a tumor that is in there, that is structural. So it means that tumor, you need to have some investigation like colonoscopy to be able to diagnose it. Once it is diagnosed, whatever that is there, if it needs to be resected, is resected, and that takes care of the constipation that is there. It could also be that you need to check for your electrolytes. If your electrolytes are lower, it needs to be corrected. And then other times too would be that if you do have diabetes, which is causing those neuropathies, then you need to have that corrected as well. So once that is corrected, so the underlying condition needs to be treated to be able to take care of the constipation that comes with it. Aside the regular that we have mentioned, which would be your lifestyle modification, and then some of these laxatives that you can take as medical management.
Which specific groups of people does constipation normally affect?
So it
I don't know when people are pregnant.
Yeah, so it can affect a pregnant person because of the gravid uterus having to reduce the peristaltic effects on the GIT. Yes, it affects. So it affects almost every group. Every age, even babies. And even babies, if it does happen to them, then you need to look at other things. Is it a congenital anomaly that is there, that is causing them not to actually pass to? Is there any stenosis of some sort? Is it that so there are so many things to think about depending on the age range that this patient will present with, and also some of the other signs and symptoms. Some of them may present with not only constipation, but they'll present with the fact that now I have unexplained weight loss. That is not intended. Right. So if that is happening, then you'll be leaning more towards, okay, is it likely that this patient may have some tumor or cancer in there that is causing that? Some may come with blood in stool, aside the constipation that they have, but anytime they have blood, that would also help you to put the patient in a particular category. Some may also present with the fact that aside the blood, I have I've been vomiting. So that would also tell you that, okay, maybe there's something obstructing. So it is not allowing the downward movement. It's also causing the buildup of whatever that you're taking. And then now you end up, because it's not going down, it has to find its way up. You get, so you would have to look at other signs and symptoms that they present with the constipation, and then you would be able to diagnose appropriately and give the appropriate treatment for such patients.
Doc, so in the instance that someone is constipated, what should be the, first thing, or how do you properly use the toilets? Because you said if you strain, you might get hemorrhoids and all the complications associated with it. So what's the first thing that you should do when you finally go and sit on that toilet and try and push?
Okay, so the first thing that you do is that, first of all, you need to be able to tell. So let's look at it as is regular constipation and not anything else. Okay, so if it's regular constipation, the first thing is you need to do some diet modification.
Okay.
So your diet modification, you need to take in some fruits and vegetables that would help increase the bulk of the stool.
Which ones are those?
So something like so almost all the fruits and vegetables that we have. So if you have pears, you have plums, you have, or maybe I'm mentioning a lot of exotic.
I was about to say plums, no?
But there's some of them
We're not saying they're not, but let's you get it. Let's bring it down. Let's bring it down.
Contumely doesn't work.
Contumely works. Even oranges. Okay, oranges would have a lot of roughage in there. So you need to take some quantities of these.
Okay.
That's one. After taking that, you need to also take a lot of water. Okay, so once you take that as well, so it helps to, all of these would help increase the bulk of the stool, will help retain some water within the stool itself. And then so that when you go sit on that toilet, you would be able to defecate without any strain. You get it? So that is the first thing that you would want to do. If you do this and it doesn't work, then it means that you need to have some medical management. So the medical management would be, as I mentioned, so you can have some of these medications. So if you take the lactulose medication, which is prescribed, then that would also help you. It would do actually the same thing that the roughages would have done to help attract water into the stool so that you can easily pass the stool. Or the ducolas, which will help with the peristalsis as well. So some of these things are some of the things that you can actually do to help you
I read somewhere that if you're struggling and you blow from your mouth like you're blowing into a balloon, it helps,
So if you're blowing into a balloon, it's just increasing the abdominal pressures. If it increases the abdominal pressures, then it may help in a way with the peristalsis.
Okay.
So that you can actually defecate. Yes.
But
then basically you should be able to use some of these things that I have mentioned.
Says, good morning, nice work, God bless you. I've had constipation since I was 5 years and now I am 24. It's really disturbing and the piles is also really uncomfortable. I never thought of going to the hospital, but now I think I must.
Yes, yes, definitely, please do. I'm glad that you have listened, and yes, you should go, because some of these complications that you have out of it may become worse. So the earlier you do go, the better, so that these complications are taken care of, so that you don't end up complicating the hemorrhoids that you do have as of now. And then you'll be giving some advice based on what that tailors towards that particular patient or yourself, so that it helps with your lifestyle.
Our time is up,
and then
but I wanted to know what daily habits we can adopt to prevent us from being constipated.
So even exercising,
especially for some of us who like bread.
Physical exercise, and anytime you are eating all of these refined foods, please make sure that you have portions or large portions of fruits and vegetables, so that when it goes in there, as you said, you like a lot of bread. So when it goes in there, at least you still do have some roughage in there. that will help with what absorption of water, it will help retention of water, and then it can prevent the constipation that you may end up with. And yeah, so anytime so making sure that you're drinking a lot of water, 2 liters to 3 liters, fruits and vegetables in your meals, physical activity, very important. Physical activity, it helps with increasing the blood supply to the gut, and then that will also help with its movements. And then sometimes even when you wake up early in the morning, just taking a glass of water, a glass or 2 of water, that also helps with something we call gastrocolic reflex. So then it helps with that initial reflex, so that there will be some contractions to help expel whatever that is within the, or whatever waste that you have within the colon or within the rectum, so that you don't end up with constipation. Because you see, the longer these waste products stay within the large intestines, it means that what the large intestine does is that it draws water. That's where there's reabsorption. So the longer it is there, it means that more water will be reabsorbed from it, and you end up with very hard stool or dry stool. So you need to be able to, and then don't fight the urge when it comes.
Right.
Do go and then make sure that you get it out of the system.
Don't fight the urge. It's a very important advice, right? You know, sometimes it's just the public spaces we have. It is not conducive for, you know, so rather just, you know, you can see a nice hotel. I don't want to talk about, like, you know, government public spaces, the Supreme Court. You know, I thought, oh, the Supreme Court.
Really?
You know, and if you're not lucky and you go to one in a stadium, trouble. But Doc, thank you so much. Thank you so much for your insights as always.
Thank you,
know, for explaining it to us. We've learned a thing or two, and we'll keep it in our minds. All right. So